Hello and welcome to ADAA's question and answer webinar with the authors of The Complete Guide to Overcoming Health Anxiety. My name is Jolie Busby and I'm the Education and Training Manager here at ADAA. A little housekeeping for today's session. This webinar is being recorded. Closed captioning and translation are available. Attendees at today's session will receive a link to the recording within about 48 hours. This webinar is question and answer enabled for participants to ask questions through the Q&A feature. We will attempt to address everyone's questions in the time allowed. Many attendees have already submitted questions in advance, so we'll work through those first. Now, I'm very pleased to introduce our moderator for today, Dr. Sharon Batista. Dr. Batista is a board-certified psychiatrist and assistant clinical professor of psychiatry at the Mount Sinai Hospital. She is a distinguished fellow of the American Psychiatric Association, the American Medical Women's Association, and the Academy of Consultation Liaison Psychiatry. She is currently in private telepsychiatry practice based in New York City, serving patients in multiple states. In addition to her clinical work, Dr. Batista has committed her professional career to teaching psychotherapy to psychiatry trainees and mentoring. Dr. Batista is passionate about the integration of psychodynamic and cognitive behavioral interventions into psychiatric and medical care of diverse populations, including medically complex patients and women across the lifespan. Welcome, Dr. Batista. I will now hand over the presentation to you.
Awesome. It's great to be here. Thanks for inviting me. I think the easy job because I get to introduce two people who I think have covered a very important and interesting topic, and they get to answer all the hard questions while I just sit back and relax. So first is Dr. Josh Spitalnick, and Dr. Spitalnick is a licensed psychologist, board certified in behavioral and cognitive psychology. He's the CEO and founder of Anxiety Specialists of Atlanta, an outpatient clinic and center of excellence specializing in assessment and treatment of anxiety, OCD, and related disorders, treating for all ages in Georgia and 40 other states for over a decade, which is kind of wow. Dr. Spitalnick also serves as a BTTI faculty for the International OCD Foundation. That's faculty for training, a really important training program in our field, and is adjunct assistant professor in psychiatry at Emory University, training clinicians in evidence-based intervention, including CBT, ERP, ACT, SPACE, and PCIT. Dr. Spitalnick has published over 30 peer-reviewed articles, book chapters, and treatment manuals. In addition is Michael Stier here today to speak with us. Michael is a licensed clinical professional counselor and national certified counselor that specializes in the treatment of OCD and related disorders. He currently acts as the Director of Education and Training through Anxiety Specialists of Atlanta, ensuring the implementation of evidence-based treatment interventions for OCD and related disorders. Michael has experience in treating the intersection between medical and psychological health, including treating health anxiety and other medical phobias. Michael is the co-author of The Complete Guide to Overcoming Health Anxiety and presents through local and international conferences on OCD and health anxiety. All right. So welcome to both of you. I was so thrilled that we have this topic today, and I'll just flash your book here on the screen because I had to go get it. I guess we don't even have to say shameless plug because this is just what it is.
Awesome.
Coming from where I'm coming from, you don't find books and resources much on this topic. So it was kind of a must buy, but pretending that I didn't say that, I'd love to know from you as authors more about this topic and also about what inspired you to write this.
I think whenever we first started, that was kind of the question we were going back and forth between as well, was looking at some of the information that was out there on health anxiety. And also, I know Josh and I went back and forth between multiple different times, like, would you write a book? And it's like, I don't know, would you write one? And be like, probably not. And then I think at some point we got serious. And I think one of the things that always struck for me with health anxiety is the piece of it's often kind of understood by some people on a very surface level. of like, oh yeah, health anxiety, hyperchondriasis. I know about that. Do you Google? Um, but I don't think people really understand the full scale of how detrimental health anxiety can be, as well as that there's actually treatment, not medical treatment, but there might actually be psychological treatment that can be available. And that was that was kind of what brought me to the OCD world in the first place, was that a lot of people kind of know OCD, but don't realize there's actually good treatment for it. And so that was a big motivator for, at least on my end of, when we started writing the book.
And just to add to that, I was blessed to be trained many years ago by the International OCD Foundation by a leader in the field back then, Bruce Hyman, who was well known for writing about and talking about health anxiety. So for more than a decade, I've been fascinated by the topic, in addition to all the OCD work that Michael and I do. And I really think in the last few years, a little bit before COVID and really since COVID, everyone's had a heightened awareness for all of our bumps and bruises and medical concerns. And so Michael and I decided, after he approached me about a presentation he was working on, we decided to put a resource together and didn't know if it was going to be a book or not. And from this came really trying to write a book that at the beginning was an informational resource guide, which there's a lot of books out there in the field of anxiety who start that way. And I think those are some of the best books, Sharon, that you and I and the community refers to. And I got them all on our bookshelves here by friends and colleagues, and we love those books. But Michael and I decided to go a little bit in a different direction. And that is to write a book that's not just based on the science and the facts of treating anxiety and specifically health anxiety, but we wanted it to feel like people were in session with us. And we know that in the field of mental health in general, and if we go one layer deeper in anxiety and OCD, getting access to really awesome therapists and therapists who follow evidence-based practices. It's expensive. They're hard to find. They're not easy to access. And there's wait lists, in a lot of places. So Michael and I wanted to write an awesome resource guide, which I think we did, but also one that has some humor, some good narratives, some personal anecdotes from our personal lives and from clinical professional experience we've had with permissions of our clients, keeping their information anonymous. And so we're really hoping when people read the book, they're not just learning about the do's and don'ts of managing health anxiety, but they're doing it listening to us and our tone and the way we think about anxiety, which is why we even started the first chapter, which is called The First Chapter in Becoming, in Treating Health Anxiety. It's not even about health anxiety. It's about adopting the mindset of an anxiety specialist. And so before we get into any of the weeds and details of health anxiety, we in the book did what we do in our own practice. And Michael's in his therapy office. I'm in my therapy office right now as we're talking with everyone, which is to think about, how do you think about anxiety? How do you interact with it? And even a lot of the questions that we're going to answer today are going to keep coming up with, how do you help me stop worrying about it? How do you help me make the anxiety go away? And unfortunately, the research supports that not thinking about anxiety, trying to block thinking about anxiety, is unfortunately often ineffective. And so the very first chapter sets the tone for the rest of the book about how we lean in and how we want you to become a master of managing anxiety and live with fear, not in fear. And so Michael and I hopefully have written a book that is easily digestible, keeps everyone's attention, a little bit funny, definitely fact and information based, but keeps you focused on what the purpose of the book is, and that is to basically overcome health anxiety by tackling it head on. And we've been just overwhelmed by the support online and people buying it on Amazon and asking us questions from people we've never met before. It's been just a really awesome experience.
That's really fantastic to hear. I'd love to maybe know a little bit more about this. We've got some questions we received in advance, and please, I know Julie mentioned already, write in any questions in the Q&A box that you may have as well, and we'll try to hit as many as we can. There's some lingo that came up in the questions I noticed for the questions in advance about kind of what is health anxiety? How do you know you have health anxiety? You mentioned hypochondriasis, so there's some old terminology that might come up if you're looking online about it. Tell us a bit about how to understand that.
I think the one thing we joke about is that, we kind of feel like sometimes we dupe people because it's like, hey, welcome to this presentation about health anxiety. There is no such thing.
It's not even a disorder.
So sorry.
This is not a disorder.
Not even a thing. But it is a thing. So just kind of briefly and generally, we can separate these things out in a couple different ways. One is there's some times where we all get medical conditions and it's scary. So there can be anxiety around health in itself, That isn't what we would necessarily call health anxiety per se, but there's definitely anxiety that can happen around health, especially if you get a scary diagnosis or you're trying to figure things out, et cetera, et cetera. So there's definitely that. There's also hypochondriasis is kind of an older term that really isn't used as much anymore. And we kind of split it out in two different ways, which is one is we have what we call illness anxiety disorder, which is really, we don't maybe have any significant symptoms present. So you might not have a lot of really significant things going on in your body that really trigger you to be concerned about your health. But there are some scary thoughts that go through your mind about what if I do have cancer and nobody has found it yet? And so that's what we would call illness anxiety disorder. The other thing that a lot of times we see is what we call somatic symptom disorder, which is where you do have significant symptoms. You really have a lot of chest pain. Your jaw really hurts. There's actual significant symptoms. However, maybe there has never been an assessment that says the scary thing that you're afraid that's going to happen is actually happening. And that's where a lot of anxiety is built up. The other thing that we use a lot of terminology in the book as well that centers around what you might see. It's like, this kind of sounds like terminology around OCD. We use the terms obsessions and compulsions. Now, those are just placeholders. We could talk about fears and safety behaviors. But when we think about sometimes with OCD, there can be health themes. And so all of these are bigger diagnosis in this space of this is what we would kind of lovingly call health anxiety.
And if we extend that further, we don't touch upon it much in this book, but people can have what I would describe health anxiety by proxy, which is worried about Sharon, I'm worried about you might get sick. We can have concerns about health anxiety related to harm, which might fit more of an OCD concept of health fears, which is, I'm afraid I might have COVID, but what if I give it to someone else and kill them or get them sick? And so there's other versions of health anxiety out there, but the book really talks mostly about if you feel like you're concerned about getting some sort of medical diagnosis, as Michael said, whether you have the presence of physical symptoms or not, you're afraid that something is there and has not been identified, and what are you supposed to do about it? And so that's the book really tries to address as much as we possibly can in that space of helping people manage fears, assuming that they're not currently battling a serious medical issue. And for any therapist who specializes in OCD, anxiety, and specifically health anxiety, Michael and I are pretty upfront about that in the book, which is we're not here to play doctor. We're not MDs or DOs. We're not waving around some medical license here. So if you have new onset of physical symptoms that you're concerned about, or your physical symptoms are severe or happening more frequently than you think they should, go get a medical consultation. Go get a workup. So any therapist who's specializing in the space of health and medical fears is not asking you to not go get a doctor's appointment or follow up with, whatever procedures you're trying to have. We're trying to help people through that process, manage everyday moments where they can live in the moment and be functional and adaptive while they're either managing the fears associated with the potential of a real medical issue or just managing everyday life. So I hope for any people new in the field, professionals, or anyone who's going to see a therapist recognizes that go get a medical workup, go get a consultation, meet with a physician. That's a normal beginning process for all the work we do. It gets challenging when someone's gone to multiple physicians or gotten the same consultation multiple times, or asking all their friends and family who are in the medical field, do you think this is something? And then it gets into a different space, which is what Michael and I have written about in the book and like to talk about. But just want to put that out there, which is anyone who's experiencing new onset of physical symptoms, please go get a medical consultation.
Yeah, agreed. We wouldn't want to encourage somebody to ignore something that's really bothering them physically and could be serious without having evaluated it. This does touch on a topic that a couple people wrote in about. There's some people who wrote in that they themselves been through pretty serious or traumatic health crises and were suffering some consequences, but then also experiencing like new symptoms and not having like their experience, their feelings validated. And so for people who've had real health concerns, like how would you address that in this area of health anxiety?
So we know that people who battle health anxiety can have no history of medical issues or a dominant history of medical issues. And Michael and I do see, and most people who specialize in this space see individuals who have had significant medical concerns or issues, even not ones that are present, and they're afraid about them coming back. or they've had a significant hospitalization and they're afraid that what if this happens again? So to start, if someone comes into treatment or comes into therapy with a history of a significant medical concern, any therapist should be addressing that, whether we would call that a trauma or a significant event that's impacting someone's current, functioning. It would be appropriate to address sort of their fears, their concerns, any existing medical issues, any existing medications they're taking. Michael and I will do consultations with their medical providers to make sure that we're not violating or disrupting their ongoing care. But if someone has a history of a significant medical issue, I think any healthy person would be afraid of that coming back in the future. And so a therapist can help support someone in that process of making appropriate medical decisions. If they're on medicines, maintaining medication compliance. If they're meeting with providers, going to those appropriate appointments. And then in between those notes of medicines and appointments and upcoming procedures or no upcoming procedures, living day to day in a way where you're not just responding to all the anxious worries that you have, especially those that are not warranted or supported. And that becomes a real dilemma, Sharon, which is when people are not experiencing physical symptoms or have no history of physical symptoms, I think a lot of people would easily go, oh, well, let's just find a way for them to move on. But a large number of individuals have a history of a significant medical experience that is making them feel worried. And so we can still help people in that process of managing everyday fears and abiding by their medical recommendations and protocols, but also in that same moment, concurrently, while they're worried about something, doing things in their everyday life, which we talk about in the book quite a bit, that maximize their world, that make their world bigger, that connect with friends and family, that don't disrupt work or other obligations. So that's every therapist's goal in treatment. Well, they're talking about depression, substance abuse, in this case, health anxiety, which is support someone in the process of what they're going through, which is kind of trying to take away the negative symptoms and concurrently add to their life, adding to joy, positivity, and helping them do things aligned with their personal values and wants and needs in this world. If you can hit both of those notes, you've done a successful job as a therapist, and whether you see a therapist or not, in your own world. But we do see people with a significant medical history that they sit around wondering what if it's going to come back. And I think most people would be worried about that. So we can just help someone process that information and help them make decisions on what's really going on in their current present medical status.
Michael, I don't want to, if you wanted to add anything, I want to jump to the next question without giving you a chance at that one.
I would say the only other thing that I would add in there, just as a piece that I know that we always try to address too, is that when you're talking about, previous medical conditions, and even just like I saw some questions kind of popping up about experiences with the medical system. The one thing we always try to acknowledge is that for, research has been shown that women and people of color usually have worse of a chance to get good, effective medical care. So what we really try to lean on is if you really feel like you're not being listened to, if your concerns are really not being addressed, if you don't have a trusting relationship with that medical provider, it's okay for you to go and to find somebody new. And that starts to kind of feel a little bad because when we think about health anxiety, then we think about talking about pursuing other medical providers. But to me, there's a big difference between not feeling as if we're being heard or being dismissed versus we have a relatively trusting relationship with the medical provider and we doubt that piece. And so that's the other piece I would just always like to throw in there because, experiences with the medical system, whether it is previous experiences like Josh was mentioning, or just kind of your overall experiences, we always really try to advocate for people in those situations. If you're really feeling like you're not being listened to or taken seriously, or if your questions are not being addressed, to seek those, because that is in your right to be able to have that. Once we have that, and once we feel like we have a relatively good relationship, that's when we can work on some of the psychotherapy things that we can talk about as we go forward. But I think that's an important piece that we at least address because it's prevalent.
And Sharon, to add to that, Michael and I run a national health anxiety support group. It's free, it's online, it's connected to our website at Anxiety Specialists of Atlanta. It's grown significantly in the last few months since the release of the book, which we're very proud of. This topic, which comes up a lot, came up in the last group, which is, what if I have concerns about talking to my medical provider? And so to Michael's point, whether it's because you're in a marginalized population or you just don't feel connected to your medical provider, choosing another medical provider is your absolute right. But another option is bringing someone, a loved one or a caregiver with you to that medical appointment. If you get flustered, writing down some of the questions you have in advance so you feel like you conveyed or communicated to your provider, whether it's a nurse practitioner, a PA, or the physician, him or herself, like that information. A lot of us show up and we forget all the things we wanted to say. So we always advocate for people to show up with a prescribed list of things you want to accomplish in that medical appointment. And Sharon, it doesn't always guarantee that the physician, he or she is going to follow that, but at least that's a starting point of baseline preparedness. But also bringing someone with you that you trust, that is not, tethered to the worries and the fears, that can hear sort of objectively what's going on with that provider. So that came up in our last support group, which is how do you navigate the balance of what Michael said, reassurance seeking, doctor shopping, which is sort of that naughty taboo topic in this area of health anxiety, versus truly advocating for your needs. And there's many ways to do that without just going through multiple medical providers. I would start with showing up with some information you want to make sure you get clarified, and bringing a loved one with you to sort of be there to support you and make sure that you kind of communicated what you wanted to get out of that appointment. Those are two really good starting points before you start going through the effort of going through different medical practices, which, as you know, it's hard to get connected to.
For sure. So yeah, making like utilizing what you've got like best you can.
Yep.
That makes a lot of sense to me. And not everybody can just go get a new specialist like overnight, right? So sometimes like whoever you're working with, if you can improve your communication with that, I'll say physician for lack of a better word, a specialist, primary care doctor, whoever it may be, like that might be like the path of least resistance. And to even feel more empowered, right? To be able to ask questions and like kind of have more thorough answers or a thorough look at the situation. Yeah. Some of the questions we received, just jumping off of that theme for a second, but related is even, well, but how do I know if this like health anxiety, this label kind of applies? Some people were kind of asking like, well, if you got the book, right, you probably you're feeling more strongly, but what if I just don't know? What then?
Michael, you want to go? You want me to jump in on this?
Well, I think not knowing is such a big it's such a massive cornerstone to these. And, I think the one thing we always have to look at is like, well, at what scale and what cost. And kind of back to what Josh was talking about is, at what cost is this also having in your life, whether it is to other people in your life, to responsibilities you have in your life, or just time and energy and effort of how, I think it's fair to say, going back to when we think about those terminologies, there can be time where we worry about our health. I think if anybody would say that they've never worried about their health, I'd probably just call you a liar, although don't take any offense to that, because I think everybody does worry about their health. It's getting to the point where it starts to take away joy from life, where it has become intrusive. And I think that's one of the big things when we even talk about that distinction between, should you keep going back to the doctor or try to accept the answers that you've been given? That's a hard one and a loaded question that unfortunately there's no good answer. I'll read ahead in the book. There's really no great answer to that. But I think a big piece and a big component to that is, well, one, if you've picked up the book, you probably are dealing with some health anxiety. And also, I think I would just really start to take an evaluation of, everyone does have worries. However, how significant and how impactful do I feel like those worries in my life? And how much does it take me away from maybe some of the things that are most important to me? And if we start to make that assessment and being like, wow, I spend a lot of time, effort, money, whatever it may be on this, and there's really nothing that comes to fruition from it. Maybe that's what I would consider is like, well, maybe I'm dealing with some health anxiety at that point.
Yeah, so the costs, right? The downsides, like the degree to which a person is distressed or suffers, or that their quality of life is limited or their function is limited based on like the mental health aspect of these worries.
And the beauty of that is, Michael, from that formulation, we talk about sort of frequency of concern or intensity of concern. If your life is being impacted by how often you're thinking or worrying about it, whether it's the presence of real medical issues or not, or how intensely you're thinking about it, completely shut you down in that moment for hours. You can't go to work that day. that's a pretty good indication for most people. Whether they're talking about depression, substance use, family and marital issues, that's a pretty indication that something's not right. But you don't have to see a therapist. You don't have to take medication to work your way through these things. We just know that those kind of services, especially those that are evidence-based and following the science of treating these things, is a really good starting point. But that's why we honestly wrote this book. That's also why we built a free companion website. We have a whole website that sort of is a corollary to this book, Sharon, about getting really good fact-based information out there, because the research is pretty consistent, which is that cognitive behavioral therapy, which is the language and approach of how we wrote this book and the kind of therapy that Michael and I do. I know you in your bio, and you've bridged your career, besides being a pharmacologist prescribing medicine, are doing a wonderful job blurring the bridge of psychodynamic and cognitive behavioral therapy. That cognitive behavioral therapy, and specifically something called exposure-based therapy or exposure and response prevention, and another intervention called acceptance and commitment therapy, have ample research out there that show that if you're struggling with problems and you can find a therapist or find resources, which is what this book is based on, aligned with that approach, you have a fighter's chance to figure out how to identify it, how to solve it, and how to stay as far away from it as possible. That's exciting for us. And that's why we wrote the book. That's why we're offering a national support group. It's really international. People anywhere around the world can log in and Zoom. That's why we built this website. The website's it's in the chat, overcominghealthanxiety.com. Because Michael and I know that it's really not easy to find credible information. The ADAA, I've been a member of for over 20 years, I think at this point, the International OCD Foundation are two wonderful organizations that offer all sorts of rich information in forums and town halls and events just like this about OCD and health anxiety sort of at a global level. And just getting resources there and getting support there and finding out sort of what you're going through, I think is a beautiful starting point. But it does come back to, am I experiencing a disruption in my life, which is how, Sharon, you and I define diagnoses. Whether someone's just sad or they're experiencing something called clinical depression is a difference between the frequency and intensity of symptoms. We all feel sad. We all worry about, Michael, as you said, like medical things. But is that worry disrupting your life? And if it is, we would strongly encourage someone to seek help. Obviously, from a professional would be ideal, someone who is experiencing these kind of interventions. But there's just such good information online. We just try to bring a lot of that to the forefront because there's no real special place out there for health anxiety. There is for other kind of issues, but health anxiety is sort of this weird nebulous place. So hopefully Michael and I have brought some of those things together to make accessing that kind of information much easier.
Yeah, like I said, I think this is a pretty rare resource. I mean, yeah, the book, the website, the support that you're offering now. I mean, it's really a rare thing. Some people wrote in, and it seemed like we also have not just people who suffer from anxiety or are curious about this topic, but people who are loved ones, could be parents, significant others, friends, relatives. And their general questions are along the lines of like, well, how do I support someone I care about who's probably going through this? Or like, what can I do? Any suggestions?
Michael? Oh, there it goes. Sorry. Can you hear me now? It would not let me unmute.
You're good.
Okay, good. Thanks. I think when we think about the structure of it is whether it's something that somebody's dealing with individually or if it's for a family member. We have to remember is like, a lot of times the structure can be the same. Now, I guess there could be two questions with this, which is, do I excessively worry about someone else's health? So for instance, a lot of times parents will get caught into this trap at some points where they, understandably, because they love their children so much, they may have a lot of obsessive thoughts and I see it turn into a lot of checking behavior, a lot of temperature checking, a lot of those different things. So I think in that case, we could say it's like, well, we could conceptualize that as like, well, maybe that's health anxiety, kind of like what Josh was saying earlier by proxy of we're being afraid of the health for someone else. The other place I see this most often is a lot of times for adults, but maybe their parents are aging and they start to, this is where we start to walk the line between, I think at any point when we have parents aging, we all worry. And also sometimes that worry can become to a level that it starts to impair life, or we start to bug them way too much about like, have you gotten this checkup? What did they say? All of those things. So I think there's that level where sometimes we could have anxiety health anxiety for other people or concerned about their health. The other way that we could take that question is also thinking about, what if you're trying to support someone, whether that is you have a child that has health anxiety, or you have a spouse that has health anxiety, or a family member that has health anxiety. It's hard to say 3 times. Hopefully it's not like Beetlejuice, where Beetlejuice shows up. So, and there's a lot of good resources out there. I know that our practice also runs a health anxiety and OCD romantic partner and spouse group support group, which has been I think we might be feeding people from our health anxiety support group to that group. It's awesome. They love it, because I think what's inevitable is that health anxiety becomes a family system thing, right? Is that, for clients, if the person with health anxiety is going to the emergency room, now the other parent has to figure out, it's like, okay, so how do I navigate life, or how do I navigate this dynamic? And so there's a lot of things there's a lot of support that's out there in that space. But I think what's fair to say is that even though the person with health anxiety is suffering, a lot of times it does have an impact on the bigger family system. And that can be really challenging. It can be really difficult. So I think the biggest thing that we have to kind of recognize with this is that one of the first things I usually tell with family is validation is always really important. Because I think a lot of times with people with health anxiety, they become very invalidated, especially with a lot of medical providers. A lot of advice of like, hey, you're fine. Or my favorite is, it's just your anxiety. As that's like, oh, well, I'm so glad you said that. I can just move on with my life. And so I think validation, at least on a level of, understanding how intense the anxiety can be so important just for family members. Because in a lot of ways, I think their health concerns can feel really invalidating at many points. Josh, you want to speak anything else about families?
No, I mean, that was well said. I think that's the neglected area in the field of anxiety, depression, substance abuse, bipolar disorder, OCD, health anxiety, is how do we support the caregiver system run? I think Michael said it beautifully. And organizations like the ADAA put out information about supporting families and kids in school. I feel like, Sharon, we're not trying to oversell anxiety specialist of Atlanta, but we have one of the largest anxiety OCD specialty teams in the Southeast, maybe in the country. We have almost 25 providers doing awesome stuff, but we offer a ton of free support groups. Again, this is coming from the mission that Michael and I and our other directors are a part of, which is increasing the accessibility, the availability, the affordability of evidence-based practices. And so I'm blessed to oversee a team of amazing providers, amazing anxiety specialists who offer all sorts of support groups, free support groups for parents of kids with anxiety and OCD, romantic partners of individuals battling OCD and health anxiety, people battling things like body focused repetitive behaviors, and and actually starting tonight we're offering a new OCD support group for adults. So the corollary of family members is critical, because the individual suffering, he or she is obviously hopefully getting treatment or doing their own thing, but we know it impacts the system. So anytime the system can get their needs met and get their support needs met, to Michael's point, then they're in a better position to validate the loved one, support them, maybe even show up to the therapy session, maybe point them to credible resources. So I'm hoping there are people listening to this live or watching it down the road who are the loved ones of health anxiety sufferers, or maybe buying this book or pointing them to the resource that sometimes is the loved one who has to get someone to that space. And so we're speaking to them as well. We didn't write that much about it in the book, about being the loved one, but the loved ones sometimes have to, carry some of that burden to get someone to the proper support space. And
Agreed.
if we can help in that process, that's great.
Yeah, even loved ones have to get their own support and own
Yep.
professional help, because it's kind of hard, like being in a spot where you don't know if like, you're doing the right thing, and how you can help but not hurt, and things like that. So
Yep.
it can be really tricky. Um, oh, sorry, go ahead.
I was just gonna say, the last thing I'll just throw in there too is that, as much of a struggle it can be, and 100% agree with everything you guys are saying. I think the other thing that's really important to kind of remember as a family member is that you are an integral part of the solution as well. And one of the things that I usually try to focus on, especially when we think about this joy or values-based piece, is that if we can take the time away from health anxiety and invest it back into the family, and the family member can be such an important piece of that too. It helps with the health anxiety, but also it starts to help with starting to rebuild some of those connections if they've been damaged, and starting to build some more positive experiences in the relationship. So I think that's a really important thing to kind of remember is, as much of a struggle as it can be, there, family members are such an important part of the dynamic of that, and really can be such a big piece of the treatment plan too.
In hearing you both talk, it reminded me of, I think, overlooked but like favorite question that you'll know why I'm asking. So, how do you get proper treatment? Like, how do you know how to find the right treatment? You said this thing, exposure, response, prevention.
Oh, goodness.
You said, right? You said some lingo, but
Yep.
you're preaching to the choir if it's me.
Let's do it. Let's
yeah.
do it. So I'm assuming people who have connected to this webinar live or post-event recording already have some connection to either Michael and I, you, or the ADAA. The ADAA is the leading organization in the country, in the world really, about disseminating evidence-based practices for anxiety and depression interventions, both psychotherapeutic, I'm pointing to Michael and I, and then psychotherapeutic and medication and other biologics, Sharon, that in the space you're in. Everything I'm going to answer is going to be based on the premise of evidence-based practices. So to understand that, you have to go back a step and figure out, so then what does that mean? What that means is there's been tons of research out there, thank goodness, conducted by well-intentioned researchers at the National Institute of Health and other organizations who have found that the concept of psychotherapy, talk therapy, from an approach called cognitive behavioral therapy, which is a way in which people do therapy, as opposed to psychodynamic or analytic or hypnotherapy or things like that. Cognitive behavioral therapy, which is the parent umbrella of a kind of intervention, is a good starting point. And so any organization like ADAA that supports and disseminates evidence-based practices, I always say start there. The first intervention of this book, the first intervention of everything Michael and I do, is called psychoeducation. So even before we even get to therapy, you're asking me a question of like, let's get proper education out there. So for me, if I'm a sufferer of anxiety or depression or a loved one, I'm looking for organizations or clinics that promote something like cognitive behavioral therapy, exposure and response prevention, which is a version of CBT, acceptance and commitment therapy, which is a version of CBT, inference-based CBT, mindfulness-based CBT. These are all psychotherapy interventions, because we're not going to talk about medication today. That's not what Michael and I specialize in. That are designed, developed, tested, and proven that with proper training as a therapist and delivery as a therapist, you have a really good chance of managing, if not overcoming, in this case, health anxiety. So the first step for someone is to find a clinic in your local area or a therapist at a major organization like the ADAA, which you can go to adaa.org and click on Find a Therapist, or other organizations like that, where you can find a therapist from organizations that espouse, that support evidence-based interventions. And no matter what we talk about, whether it's on paid websites or advertising websites or nonprofits like ADAA, Michael and I stand behind in our clinic that an evidence-based practitioner is the beginning and end of getting any sort of talk therapy intervention. And there's a lot of language out there in talk therapy of different orientations, Sharon, which is important to put out there and get people supported and build up hope, but there's also some interventions out there that can be harmful and expensive and not helpful. So if someone's trying to find a therapist, the first step is to look for someone who does some version of cognitive behavioral therapy. And underneath that is a bunch of interventions like ERP, which stands for exposure and response prevention, or exposure therapy, or ACT, acceptance and commitment therapy, mindfulness-based CBT, inference-based CBT. These are all research-grade interventions that have been demonstrated to be highly effective for most of the anxiety disorders out there. And that's the beginning point. Michael, I'm sure, has other things to share on this topic, but through and through, the book, what Michael and I preach, what we teach people, how we train people, trainings that you've been a part of, is all starting with, are you following the science of psychotherapy? And if you're not, I just don't refer to or support clinics or clinicians who are duct taping therapies together or coming from an uninformed place. That's my first starting point. Find organizations, local or national, that are supporting evidence-based interventions, and usually CBT, which has been researched plenty of times for health anxiety specifically, is demonstrated as the leading intervention for effectively treating health anxiety. Michael, what would you add to that?
I think the only other thing I would add to that is that, it's hard to be able to find that information if you don't know where to look. I think there's a lot of well-mannered people that are in therapy trying to get better. And I think one of the sad things about that is that a lot of times I see where that comes if we don't have those resources is that it becomes very frustrating because it feels like I'm doing all the right things. And it, life is still spiraling, and health anxiety is still out of control. And so I think the important thing about that is just finding a treatment that's tailored to some of the things that you're dealing with. A lot of times, at least for health anxiety, talk therapy might not be the way to go. You might talk in your head a lot right now about trying to talk yourself out of like, no, this medical condition is just fine and nothing's going on. And so I know in our book, we really try to talk about in that first chapter, lovingly known as the first chapter. You can see our personality coming out of this book. It might be goofy and some people might think it's stupid, but I think it's
We're
hilarious
okay with
too.
that.
We're okay with that. Yes.
Yeah.
Yeah. It's kind of like all those movies that I like, but my wife eye rolls at, like Airplane, I think it's hilarious. And she's like, you like this? And I'm like, it is hilarious. Do you not see this? But anyway, I think what's important with that is that this is what we talk about, this mindset of an anxiety specialist, which may start to have treatments like we were talking about that may just do things a little bit differently. It might do some things a little bit backwards that seem a little counterintuitive. And also, searching for some of these answers that you might be looking around your health may not always be the most best use of your time, because your brain might always circle back around. So I think all the resources that being able to find some of those treatments can be helpful, just because I think a lot of people get stuck in the system trying to get better, but they might just be spinning their wheels at that point.
Just clarify lingo, because we have people from kind of all over, and non-professionals attending this webinar as well. When you say talk therapy, you really mean traditional, maybe like psychodynamic or analytic or process-oriented treatment, where the treatment really consists of coming to sessions and talking about what's on your mind and what you're going through, and going home and coming back to session the following week or something, and again talking about what you're going through is like traditional talk therapy. What would the kind of right therapy, a CBT type therapy, kind of look like? How would you know if you're getting that?
You want to start?
I'll jump.
Can we start?
I'll jump in this. So,
All right.
so it really does begin with going through obviously a website or a bunch of information to see if someone actually is trained in something called cognitive behavioral therapy. And again, cognitive behavioral therapy has lots of subdivisions of it. That can get tricky. Michael says like it's hard to find the right therapist. So I'm less concerned about finding the right therapist, because even finding the person that you match with can be its own art and science challenge. But finding someone that speaks to interventions that fall under cognitive behavioral therapy, things like behavioral activation, cognitive restructuring, a technique called exposure therapy or exposure and response prevention. But going to someone's website, and most therapists on a website are going to list the different ways in which they treat interventions. And unfortunately, there are certain interventions that just have not been demonstrated to be effective for treating things like health anxiety and OCD. That doesn't diminish the value of things like psychodynamic or psychoanalytic therapy. For certain problem areas and for certain people, it might be the most effective. But specifically for things like OCD and health anxiety, the research is just undeniable that those are the kind of interventions you want to do. So CBT is still talk therapy, but there's a difference between symptom-focused therapy, meaning that there's bumps and bruises or worries or thoughts or feelings you're struggling with, versus just processing and talking about life. And in cognitive behavioral therapy, besides me learning about you and you learning about what therapy is, I'm going to hear things you're struggling with and then give you something to do in session, away from session, and then we're going to come back and talk about it in session to learn more things to do in session. And so these are called skills. Sometimes they're just about basic symptoms. They're about changing an action at home, or changing a thought pattern that you're having, or changing how you think about thought patterns. But I'm going to teach you specific skills that address the way you think, the actions that you're doing, and sometimes physiologically or emotionally, how your body's operating. And so those are specific skills that a CBT therapist is going to teach someone. And then we're going to customize those to someone's specific worries and problems. And so Sharon, you're asking the $1 million question, which is how do you find a good person that does what you do? And that's hard. And that's why ADAA has researchers and clinicians presenting around the world and doing things like this to disseminate, this is an intervention, this is a problem area, health anxiety. I know last week you guys did a wonderful presentation on body-focused repetitive behaviors, an awesome book that Michael and I have as well, and they focus on specific cognitive behavioral interventions. And so it begins and ends with finding interventionists, therapists, who are trained in the skills that we talk about in this book. I'll go one layer deeper because I'm mindful of the time and depending on how many questions we get, a question that Michael and I get a lot, which is, what if I never find the therapist? What if I can't afford the therapist? Where do you recommend I start? Just like helping with my own health anxiety. And Michael and I sometimes get asked to be on Facebook and other social media listservs of people venting about their health anxiety. Like, hey, can you help us? And we're shy of that because you have 30 to 50,000 people venting about their health anxiety. That's a tricky thing to navigate. But the first thing Michael and I will almost always say, if you do nothing else, start with learning what your symptoms are. Michael referenced them earlier, T's, O's, and C's, which is how we reference the symptoms in this book. We reference triggers, obsessions, and compulsions, which is an OCD kind of acronym. Some people use the acronym T's, F's, triggers, fears, and SB's, safety behaviors. 3 categories: what bothers you, why you're bothered, and what you do about it, whether you mean to or not. I start there because that 3rd category in OCD and health anxiety, we call compulsions, rituals, avoidance, safety behaviors, basically behavioral or mental things you're doing to try and manage feeling like crap. And so unfortunately, those work a little bit for a split second or two, but they actually create a bigger problem. So whether you can find a therapist like what you are doing and what we're doing, whether you can find the right website, whether you get this book or go to free resources that we've put out there, the first intervention, the first tip I recommend for anybody is learn the symptoms that you're having. What are the T's, O's, and C's of your life? And if you can identify the compulsions, the rituals, the safety behaviors, the things you're doing, checking your pulse too much, wearing a pulse oximeter way too many times, getting multiple COVID tests, avoiding doctor's appointments, doctor shopping, asking your medical friends. We have a long list in the back of the book, and that same list is on our website that you can download. The things that you're doing that you think you want to be doing that are actually creating a bigger issue, if you can identify them and start to reduce them and replace them with more functional, healthy behaviors, things that are better for you, things that add to your life. So instead of texting your mom or your sister, hey, do you think I have this? Text them and saying, hey, I love you. Do you want to grab lunch? You can still text them, but text them with something that adds to your life as opposed to try to solve a conundrum that you may or may not get the answer to. So you're asking the important question, which is how do you find a good therapist? We just want to get good information out there to start. And that starts with know your symptoms, the things that you're bothered by. And if you can eliminate and reduce those nasty compulsions and rituals, we call it category 3 or the letter C, and replace them with healthier behaviors, at a minimum, you've made your life better with or without a therapist. And I just want to stress that to the people listening, the professionals that are supporting stuff. Every CBT intervention of all the different techniques that are out there all agree, reduce and eliminate rituals and compulsions. And you've now opened up space in your life to replace with something more loving, more joyful, more healthy. That's a great start.
I think the only thing I would just add to that is just, we think about what makes that so important and how that becomes such a deep, dark hole with health anxiety. Because, health anxiety really becomes the catch-22. The more you spend time in it, this happens a lot of times with physical symptoms, which maybe if people are listening live or afterwards can recognize, is that the more we focus on our bodies, the more we notice. And I think that's where a lot of people get caught. Is my chest really feeling bad? I don't think so. Oh, maybe it is. What was that?
Yeah.
What was that feeling? Right. And then the spiral just comes down. And so I think when we're thinking about reducing those things, it also gives us an opportunity to be able to move on. Because if we're not engaging in some of those really joy-filled experiences that we could have in life, a lot of times the only other option is either to be really focused in our bodies or focused up here. And a lot of times that's trying to figure things out, asking what ifs, all of these different things. Now, when push comes to shove, when we try to do that, it's hard. It's anxiety provoking because we feel very urged to be like, I need to get this answer. I need to hear this reassurance. And that becomes part of the work of, can I embrace some of that to be able to have the opportunity to be able to enjoy really important things in my life. And that starts to become the process. I put in there, so I didn't realize I was just doing the panelists. So thanks for reposting those. But I did put in a longer list of our TOs and Cs from the Overcoming Health Anxiety website. So you guys can go on and read on there and kind of get a little bit more in-depth view. And there's those two big lists that you could go through and start to kind of see how it's kind of outlined and everything.
Yeah, one theme in the questions was a little bit about what does health anxiety kind of look like on the more granular level, but also what does recovery look like too?
So I'm going to start with the evil thing I say in therapy all the time. We probably mentioned in the book a little bit when someone says, hey, what's your chief goal? Or, what do you want to get at therapy? And they say, I don't want to worry anymore. Michael and I, with love, will say, then you found the wrong therapist. Because I'm not in the business of helping someone not worry. We don't want people to worry, Sharon. We don't want people to feel pain. We don't want them to be in distress. But having worries, having sadness, having discomfort does not have to stop you from having a life. And so I've used the phrase earlier, I'm going to use it again, living with fear, not in fear. And that concept is really what we're talking about here. So for me, teaching someone the ability to be okay, not being okay, which we put in the first chapter, is the starting process of becoming this anxiety specialist. So I want to emphasize that right there. Sometimes the goals of what people want and what maintenance looks like is like, hey, I want to be anxiety free. I want to be back the way I was before health anxiety started. And my response is, I don't want you to be back to version one. Version one of you, before you had this debilitating health anxiety experience, had no idea how powerful you are, how you had the ability to hold two worlds of being anxious, but also being functional and alive, how you've learned so much. Let's not go back to V1. Right now you're in V2. Let's make you a superhero in V3, someone who can be in distress and also fully engaged in life, or someone who's preoccupied with worries and concerns about their health in a business meeting or at home, but looking like you're engaged with your loved ones or at work. So sometimes people think that post-treatment, the real goal is to be either worry-free, anxiety-free, or never think about health anxiety. And Michael and I don't promise that. No anxiety specialist that I know of would promise that. Talk about like, how do you find a good anxiety specialist? If someone says, I'm going to help you take all your worries away, run. I just don't believe in a world like that. So I do believe in our goal of wanting you to reduce the discomfort, the distress, and the worries, but that is not even close to our first mission. Our first mission is to teach you that you can, at the same time feeling worried or having distress, pursue all the things in your world that make you feel in love and feel loved and make you happy. And so the best case scenario outcome is that, yeah, you never have health anxiety again. You never worry about it again. But Michael and I know everyone worries about health anxiety. And I'm sorry to say this, and I'm trying to trigger people, but we're all going to die one day. That sucks to admit. Between now and the day that that happens, are you doing the things that you think you want to do that make your life bigger, better, and more beautiful? And you're sharing it with the people that matter to you? And if you are, I don't care if you worry, which is such a weird therapeutic thing to say. I don't want someone to be in distress, but that's not my bigger concern. My bigger concern is, are you maximizing the time you have with the people that you have it with? Comma, oh, you're worrying? Well, welcome to the club. We all worry. So for me, that's the outcome of having skills that teach you how to manage distress and anxiety and concurrently living a full life. And if over time that distress and anxiety remits and really kind of stops showing up, well, good for you. You're probably in the minority. We all have bumps and bruises, mentally or literally, but we all don't live the fullest lives we possibly can. So if I can help someone accomplish that and they don't worry anymore, you're lucky. But if you have the skills, then you're going to be happy. And that is, to me, the major success of the book. Cognitive behavioral therapy, being an anxiety specialist, everything that we promote and teach is about living in a world where you can be in distress, but also be living a full life. And that's, by the way, the subtitle of the book, which I know in all the places you guys have, The Complete Guide to Overcoming Health Anxiety. There's been some other wonderful books over the last decade people have written, but the subtext, Sharon, is critical. How to live life to the fullest because you're not dead yet. And we're not doing that to trigger people. We're doing this because you can both be struggling and living a full maximum life. And so I have some people in my life that right now are going through some very serious medical things. I love you, Mom. And how do we help her get proper treatment, but also maximize whatever she has at her disposal right now? And if she's doing that, she has the best chance of beating what she's going through right now. And that's all we can offer someone besides any basic skills that someone needs to learn how to manage anxiety.
Yeah, I mean, you sound like kind of so mean,
I don't
like you
want to
don't
be mean
care,
about that.
right? They have anxiety, but the point is that when they're doing better, they also won't care if they have anxious thoughts
That's it right there.
and worries, right? And that's super liberating.
Redirecting your energy mentally and physically to the things that matter. That's not distraction. Michael and I talk, we're not doing distraction, which can help a little bit. We're redirecting you to the things that matter. Oh, by the way, I'm worrying over here. I'm okay with that. So it's weird, but Anxiety Specialists of Atlanta is not in the business of getting rid of your anxiety, sort of. It's in the business of helping you live a full life, whether you're anxious or not. That's awesome in therapy.
I know we're coming just up to the hour, so we're going to be wrapping up shortly, but I think we have enough time for one last question. And so the last question is kind of like a bit of a, I'll call it a bit of a freebie. Is there anything that I didn't ask you that you would have wanted me to ask on today's webinar, that you would have wanted to share with our audience?
I think the only thing I would add, just to kind of wrap everything up, I think we touched on a lot of really important and tough questions too. You know, when we start to have those questions about, which is natural, I think each one of my clients, we always get to this point of like, you know, some of these really tough questions, you know, what doctor, or, you know, do I keep going back? Do I not keep going back? But the way we end our book, and I think just kind of, you know, piggybacking off what Josh says, is that, you know, with health anxiety, that's health anxiety's game, is just try to reduce symptoms, reduce anxious thoughts. That's its methods. And when we can start to take our life back and know, we can see that process for what it is, using our TOs and Cs, and really being able to take this other part of therapy that's so important, which is actually, what can I get back in my life? Where can I start to take power back? I've seen nothing more liberating and freeing when somebody could feel anxious and yet go do something anyway because it's important to them. And that not only, I think what a lot of times happens for people is that you're engaging in more important things that you're most afraid to lose with your health, because that's the thing we're most afraid to lose anyway. I want to go out to lunch with my family, right? But we don't go out to lunch with the family because we're worrying about our health. So if we can put ourselves in that direction, it does that. And also, a lot of times when you're going and doing those things, you have less time to be able to go and worry about your health. And so if there's one thing that I want people just kind of take away from this, is that there's a lot of things that we could really focus on, of being out, how do we get things to go away? But if we can really focus on the power that we can feel by taking things back in life, that's where the good stuff's at.
Beautifully said, man.
Agreed. Hey, Julie, you here to kind of wrap us up?
I think so. We are closing in on the end of our time. We had a lot of questions come in through the question and answer. Hopefully, we got to a lot of those, even if it was just a general answer for that. Everyone is certainly welcome to reach out to us at webinars@adaa.org if you would like to follow up with questions, and I'm happy to share with our presenters today. And with that, first, let me just thank our presenters, Josh Spitalnick and Michael Stier, for presenting and sharing your insights into this book and answering so many great questions from our audience. And thank you, Dr. Sharon Batista, for being our excellent moderator for today. I'd just like to share a little bit about the Anxiety and Depression Association of America. It works to prevent, treat, and cure anxiety disorders and depression through the alignment of science, treatment, and education. I have a little slide here. Let me pull this up. Sorry about that. So we invite you to explore our website at adaa.org, where you can find resources such as the Find Your Therapist directory, which was mentioned today, free evidence-based webinars, blogs, and videos like the webinar today, our free online peer-to-peer communities, self-help books and publications, and we also ask you to consider subscribing to our free monthly e-newsletter, Triumph. And so on behalf of our presenters and on behalf of ADAA, we thank you so much for joining us, and we'll see you next time.